My name's Josiah Northern. I'm a firefighter paramedic with the Castle Rock Fire and Rescue Department. This is my partner Adam Gallegos, who is also a firefighter paramedic. And today we're going to be going over the trauma patient assessment scenario. First and foremost, verbalize body substance isolation. You can also walk into the room wearing gloves and eye protection if you see fit. Under the scene size up portion of this scenario, you'll be evaluated on 5 areas. Number 1 is to assess scene safety or situation control. Number 2, determine the mechanism of injury, be it a fall from a ladder or a motor vehicle accident. 3, determine the number of patients on your scene. 4, to request additional resources as necessary. And 5, which I'll have Adam do, is to consider C-spine stabilization. During the initial assessment of the trauma patient, you have the ability to obtain 3 points. 1, for stating a general impression, sick versus not sick. 2, to assess the patient's responsiveness and level of consciousness. And 3, to determine a chief complaint and address any life threats. Moving on to the airway, breathing, and circulation portion is next. Airway, you're given 2 points. Assessing the airway, opening the airway, making sure it's patent is 1 point. The second point is inserting any adjuncts as necessary. Under breathing, you're given 4 points. 1 is to simply assess breathing. 2 is to assess ventilation. 3 is to assess any injuries that may have occurred. And 4 is to apply oxygen. Under the circulation portion, you'll be given 4 points. Assessing pulse, assessing skin condition, controlling any major bleeding, and treating for shock. Once through the ABC portion of the trauma patient, you'll move on to a transport decision. For the physical portion of the trauma patient, you'll need to select the appropriate physical exam to perform. In this case, it's going to be a rapid trauma assessment. You'll also assess vital signs, and you can direct a partner or your evaluator to do that. You'll also need to do your best to obtain a sample history. During the rapid trauma assessment, we're going to do our assessment starting at the top of the head, down to the end of the toes, dealing specifically with the core of the body. You'll get 3 points for the head. You want to assess the mouth, the nose, and the eyes. You want to assess the scalp and the ears. And you also want to check the patient's pupils for reactivity, roundness, and equality. When we inspect the neck, we want to look at the trachea to make sure it's midline. We want to look for any JVD on either side. And we want to palp down the cervical spinal column. When we inspect the chest, we want to inspect the clavicles, down the sternum, and we want to palpate the rib cage for any crepitus. We also want to expose our patient as well and make sure we're visualizing for any bruising. So you can either cut the patient's clothes or just simply lift up and look. Same thing with the abdomen. All 4 quadrants of the stomach should be assessed, feeling for rigidity. And as the pelvis, we want to check for its stability as well. At this time, you can verbalize to your proctor that you will be assessing the genitalia region. For the extremities, we want to feel down the legs, feel down both arms. We want to feel for pulses in both, check for sensation, and check for patient movement as well. When we roll the patient to inspect their back, we want to make sure and expose their back.
1, 2, 3.
So we'll cut or lift up the shirt and look, and we want to feel down their cervical spine all the way down to the sacral, and also note any trauma to the buttocks. We'll roll our patient back down.
1, 2, 3.
At this time, you'll initiate the need for transport. You'll assess for any secondary injuries, any minor cuts or scrapes and bruises. Then you'll do an ongoing assessment on the way to the hospital. And this includes the trauma patient assessment scenario.